Edema management for subacute and chronic injuries, utilizing your TheraTouch EX4 and CX4 combo unit. In this case, we're going to use a symmetrical biphasic waveform, and the treatment approach is a contract and relax muscle pump protocol to help with removing the edema that's present in the upper extremity. The mechanism of action is believed to work through the production of repeated muscle contraction causing compression on the venous and lymphatic system. In this clinical example, we have an edematous hand with weak inhibited finger flexors, electrode placement on the distal volar surface, as you see here on the patient. You can use two different sized electrodes if necessary, but in this example, we're using two by 2 inch square adhesive electrodes. The dosing intensity is a submaximal sustained muscle contraction to create a muscle pump action to remove the swelling. This is how you set up the protocol for this treatment approach. Select electrotherapy, manual operation, biphasic and symmetrical biphasic. We're going to select the appropriate channel that we're using, and we're going to change the frequency to 40 pulses per second. We're going to change the phase duration to 200 microseconds. We're going to change your cycle time, which is your on-off time, to 3 on and 3 off. So we can customize it here and select the off and adjust that to 3 seconds. Select your intensity, highlight it, and increase your milliamps or your intensity to the desired level. We have the protocol pulled up on the screen. I'm going to go ahead and push the play button. We've already set the intensity, so it's going to ramp, and you can see that it's creating a pumping action. What we're also adding to add to the therapy is more of an active or a participating activity by the patient to actually follow along with the pattern of firing and just go ahead and squeeze with it. So we have a combined voluntary action by the patient working in coordination with the firing pattern of the protocol being used with the device.